From the moment we are born, we take our first breath, an act so simple yet so profound. This breath marks the beginning of our journey with the respiratory system, a complex and vital network within our bodies. The respiratory system is our lifeline, the unsung hero working tirelessly to provide us with the oxygen we need to survive. It is a delicate dance of inhalation and exhalation, a process we often take for granted. But the respiratory system is much more than just breathing. It is a complex system of organs, tissues, and intricate pathways. These components work together seamlessly to ensure that every cell in our body receives the oxygen it needs to function. Without this constant supply of oxygen, our cells would quickly cease to exist. The respiratory system is also responsible for removing carbon dioxide, a waste product of cellular metabolism. As our cells work, they produce carbon dioxide, which is carried by the blood back to the lungs to be expelled. This process of gas exchange, the swapping of oxygen for carbon dioxide, is essential for maintaining the body's delicate pH balance. Understanding the respiratory system is crucial for appreciating the fragility of life and the importance of maintaining its health. It is a system that is both resilient and vulnerable, capable of withstanding daily wear and tear, yet susceptible to a variety of diseases and disorders. The respiratory system's journey begins with a breath, drawing air through the nose or mouth. These entry points serve as the gatekeepers, filtering out dust, dirt, and other foreign particles. The air then travels down the pharynx, a passageway shared by both the respiratory and digestive systems. From the pharynx, the air moves into the larynx, also known as the voice box. Here, the air passes over the vocal cords, causing them to vibrate and produce sound. Continuing its journey, the air then enters the trachea, a sturdy tube commonly referred to as the windpipe. The trachea branches into two bronchi, one for each lung. These bronchi further divide and subdivide, much like the branches of a tree, into smaller and smaller tubes called bronchioles. This intricate network of branching airways ensures that air is distributed evenly throughout the lungs. Finally, the air reaches its destination, the alveoli. These tiny air sacs, clustered together like grapes, are the sites of gas exchange. It is here, in these microscopic chambers, that the vital exchange of oxygen and carbon dioxide takes place. Imagine millions of tiny balloons, each one thinner than a human hair, clustered together in your chest. These are the alveoli, the workhorses of the respiratory system, where the magic of gas exchange happens. Each alveolus is surrounded by a network of capillaries, the smallest blood vessels in the body. As you inhale, oxygen-rich air fills the alveoli. The oxygen molecules then diffuse across the thin alveolar walls and into the surrounding capillaries. This diffusion is driven by a difference in partial pressure, with oxygen moving from an area of high concentration in the alveoli to an area of low concentration in the capillaries. At the same time, carbon dioxide, a waste product of cellular respiration, travels in the opposite direction. Carbon dioxide-rich blood from the body enters the capillaries surrounding the alveoli. The carbon dioxide then diffuses across the alveolar walls and into the air sacs to be exhaled. This simultaneous exchange of gases, oxygen in and carbon dioxide out, is the essence of respiration. It is a continuous process, occurring with every breath we take, ensuring that our cells receive the oxygen they need to function and that waste products are removed. Breathing, the rhythmic act of inhaling and exhaling, is a process we rarely think about. Yet this seemingly simple act is a complex interplay of muscles, nerves, and organs working together to keep us alive. It is a delicate balance of forces, a symphony of contractions and relaxations that governs the flow of air in and out of our lungs. When you inhale, the diaphragm, a dome-shaped muscle located below the lungs, contracts and flattens. This contraction increases the volume of the chest cavity, creating a slight vacuum that draws air into the lungs. Simultaneously, the intercostal muscles located between the ribs contract, lifting the rib cage upward and outward, further expanding the chest cavity. Exhalation, on the other hand, is a more passive process. As the diaphragm and intercostal muscles relax, the chest cavity decreases in volume, pushing air out of the lungs. This rhythmic cycle of inhalation and exhalation, controlled by the nervous system, ensures a constant supply of oxygen to the body and the removal of carbon dioxide. Section 5. The Rhythm of Respiration. Every breath we take follows a specific rhythm, a delicate balance between the volume of air inhaled and exhaled, and the rate at which we breathe. This respiratory rate, the number of breaths we take per minute, varies depending on factors such as age, activity level, and overall health. For adults at rest, a normal respiratory rate typically falls between 12 to 20 breaths per minute. Children tend to have higher respiratory rates, reflecting their smaller lung capacity and higher metabolic demands. During exercise or periods of physical exertion, the respiratory rate increases to meet the body's increased demand for oxygen. Monitoring your respiratory rate can provide valuable insights into your overall health. An abnormally high or low respiratory rate can be a sign of an underlying medical condition. For example, a rapid respiratory rate known as tachypnea can be a symptom of respiratory distress, heart failure, or anxiety. Conversely, a slow respiratory rate known as bradypnea can indicate an overdose of drugs that suppress breathing, such as opioids or sedatives. Measuring your respiratory rate is relatively simple. Simply count the number of breaths you take in 1 minute while at rest. It's best to do this while sitting comfortably and without talking or moving excessively. Section 6. When breathing falters. The respiratory system, while resilient, is not immune to disease. Respiratory diseases can disrupt breathing, leading to various symptoms. Conditions range from mild to life-threatening. Asthma causes airway inflammation, making breathing difficult. Triggers include allergens, irritants, or exercise. Pneumonia inflames air sacs, causing cough, fever, and difficulty breathing. It can be caused by bacteria, viruses, or fungi. COPD includes emphysema and chronic bronchitis, causing airflow obstruction. Long-term exposure to irritants, especially cigarette smoke, is a common cause. Lung cancer, often caused by smoking, leads to uncontrollable cell growth. Other risk factors include secondhand smoke, radon, and asbestos. Section 7. The lifeblood's gaseous cargo. The circulatory system works in tandem with the respiratory system to transport oxygen to the body's tissues and remove carbon dioxide. This intricate network of arteries, veins, and capillaries acts as a vast highway system carrying blood laden with vital gases to every corner of the body. Once oxygen diffuses from the alveoli into the surrounding capillaries, it binds to hemoglobin, a protein found in red blood cells. Hemoglobin acts as an oxygen carrier, readily binding to oxygen in the lungs, where oxygen concentration is high, and releasing it in the body's tissues, where oxygen concentration is lower. Carbon dioxide, the waste product of cellular respiration, is transported in the blood in several ways. A small amount dissolves directly into the plasma, while some bind to hemoglobin. However, the majority of carbon dioxide is transported in the blood as bicarbonate ions. As blood flows through the capillaries surrounding the alveoli, carbon dioxide diffuses from the blood into the air sacs to be exhaled. This exchange of gases, facilitated by the close proximity of alveoli and capillaries, ensures a constant supply of oxygen to the body's tissues and the removal of carbon dioxide. Section 8. A delicate balance surfactant's role. Imagine trying to inflate a balloon that's slightly sticky on the inside. It takes more effort to inflate because the sticky surfaces want to cling together. This is similar to what happens in the alveoli without pulmonary surfactant, a slippery substance that reduces surface tension within the air sacs. Surface tension is the force that causes liquid surfaces to contract and behave like a stretched elastic sheet. In the alveoli, surface tension arises from the thin layer of fluid that lines their inner surfaces. Without surfactant, this surface tension would be so strong that it would cause the alveoli to collapse, making breathing extremely difficult. Pulmonary surfactant, produced by specialized cells in the alveoli, acts like a detergent, reducing the surface tension of the fluid lining the air sacs. This reduction in surface tension makes it easier to inflate the alveoli, reducing the effort required for breathing. Surfactant's role is particularly crucial for newborns, whose alveoli are extremely small and prone to collapse. Premature babies, in particular, may not have enough surfactant, leading to a condition called respiratory distress syndrome, or RDS, which can be life-threatening. Section 9. The symphony's conductor, nervous system control. Breathing, though seemingly automatic, is under the precise control of the nervous system. This intricate system ensures our breathing adjusts seamlessly to meet the body's demands. The control center for breathing resides in the brainstem, at the base of the skull. Specialized neurons in the brainstem generate rhythmic impulses for breathing. These neurons receive input from chemoreceptors monitoring blood gases. Rising carbon dioxide levels trigger increased breathing to expel it. The The nervous system also adjusts breathing during exercise, stress, and altitude changes. Understanding this control highlights the body's ability to maintain balance. It is a testament to the body's remarkable homeostasis.